As part of the African Vaccination Week, the Bono East Regional Health Directorate is urging the general public to take advantage of the celebrations to get their COVID-19 jabs, which are available at the various health facilities across the region. Regional Director of Health Services Dr. Fred Admarko-Boateng says the Ghana Health Service is working towards routinizing COVID-19 vaccines across the country, and all persons are eligible with the exception of pregnant women and children under 18.
If you look at Bono East for 2023, we recorded 18 positive cases of COVID. And then the 2024, we have recorded 2 positive cases. And these are the cases that did not come to the hospital. As of, you remember the epidemic where the pandemic people would come with signs and symptoms and you thought they were having COVID. These cases were picked from what we call our surveillance units. So we have facilities across Bono East and even across the country where we've mounted surveillance continuously. We are monitoring the cases of COVID in the population. We picked these cases from these surveillance, sentinel surveillance sites. And I want to use this opportunity to let the general public also be aware that we are now going to routinize COVID vaccines. We are going to stop this campaign. We are not going to stop drastically, but now anybody who qualifies for the vaccine can walk into a facility and have it, as all the other vaccines that we have seen.
He says the time has come for all to embrace the vaccines and do away with the myths and misconceptions associated with the vaccines, and asks that vaccines save lives.
The obvious questions then will come, and we know the myth around these vaccines, which we have discussed. I quite remember even at Tebu and in Bono East, where the women, one of the classical one that they were saying is, the moment you have the vaccines, you'll be infertile for 10 years. The men will be impotent for 10 years. You become bald. I was already bald, actually. But these are things that for all of us in this room, ourselves, our family members, had the vaccines. Our dear ones also had the vaccines. We saw that these were what really myths that people were having. And so we will advise people having the opportunity to take advantage, and because vaccines really saves life.
Dr. Fred Admarko-Boateng said the Directorate has instituted a surveillance system to enable it to identify new cases as and when they get into the region, but was quick to urge all to get their vaccines.
We know that the pandemic or the epidemic-prone nature of COVID, once somebody gets it, the cascade nature in the spread. So the Sentinel is able to capture them wherever they are coming from. Though we are trunk with the middle, highly populated, with the influx of all people internationally, locally. So we will say that, look, we will continue. But we are not going to wait. The most obvious and the easiest that you can do is protect people. And that is the vaccination, that all of us. With the difficulty in knowing all these, your best bet is what? Get the vaccines and be protected.
The Bono East region has about 52% of the region's targeted population receiving full doses of the vaccines and about 65% receiving 1 dose of the vaccine. Anas Sabit, Joy News, Kintampo.